Hi folks, I'm going to be emailing you out this link so you can access the description of the PIC paper, which will be your final assignment for the class. If you've taken a PIC class already, it's super similar as what you did in those other classes, and maybe some of those other classes might have been the Juvenile Delinquency course by Dr. Mallet, perhaps the Aging course by Dr. Hovland, perhaps Military and Social Work. And so you may have had to write one of these papers as we've transitioned to this new curriculum. So if you have, you should have an idea of how to do it. But for many of you, this is probably your only PIC class. And so what I want to do is to just go through this assignment because I think it can be a little complicated to visualize and to think about for the purposes of this particular class. So when we're looking at your PIC paper, and I'll make this a little bit bigger, there is a rubric on the bottom of the syllabus that you can use that will tell you a little bit about the expectations, and I'll be using that rubric to exclusively grade the paper. If you want to see it also, it's available on TaskStream, and you can click on the TaskStream link on the Blackboard, and you should be able to pull up the rubric for the assignment. So one thing that you're going to be doing for this is that you're going to look at a practice in context situation. Now, often in these other courses, they're talking about specific contexts, like a hospital, a nursing home, or some other facility where you might see clients. But for this paper, it's really more of the context in practice because you're thinking about specific sexuality populations that you can consider and to think about applying necessary changes around that aspect of sexuality. Now, when I say sexuality, we can talk about it globally, so we can talk about sexuality as the way that people or different institutions or policies or levels of technology approach sexuality, or we can talk about very specific contexts like how they approach sex ed or how people treat or don't treat people with certain disabilities in terms of their sexuality. So think about a specific situation that you are involved in, a particular client, perhaps with your practicum. I think that's the easiest place to visualize it. And think about a practice experience or a case scenario that I can provide to you if you are struggling to find an example on your own or if you haven't had a practicum. So you want to be able to describe certain contextual variables and how they interact or influence practice decisions. Now what you're looking at here is you're looking to really try to think about specific contexts like a specific organization, maybe a state policy or an organization policy, perhaps a certain use of technology or access to technology, or you can talk about practice decisions. So how your practicum would guide you to treat a certain kind of client. How you might need to change or your organization might need to change the objectives and the outcome measures to appropriately treat this type of client. And then you would talk about how you would bring about these changes. So maybe they're institutional changes, maybe they're changes with the manager, maybe they're technology upgrades, maybe they're policy advocacy efforts that you might do to try and enforce these changes in whatever context you're looking at. So if I scroll down to the next page where you can see the outline, so you don't have to complete all of these different pieces. You're just really looking at a specific context or a specific practice decision that you would like to change to better serve a client population. So you can select policy, technology, organization, or you can do the practice decisions. And then you talk a little bit about the client. Who is the client? What do we know about the client's systems? If we're looking at policies or legislation or culture, what do those things say about that particular client? And then you could include an ego map to really look at the client's situations. And there is an example of this underneath the welcome module. You can find the paper, an example paper from a textbook, and you can find more detailed synopsis of what this paper is really looking for. You can talk about goals, objectives, outcome measures, the use of a contract, possibly to try and help clients in achieving their goals, maybe changes in a meeting place or a physical space, how you might use the time differently, like if you're looking at changing interventions, maybe you would work in this particular area more or less. You might talk about the specific strategies and interventions that you think need to be changed, perhaps at a certain place or even across all social workers. Maybe the stance of the social worker, so the use of self, understanding your own bias, your own opinions, your own motivation. Looking at outside resources, so perhaps you can't make changes in your own organization, but maybe there's another organization that would be better suited to provide adequate and competent care for that client system. And then you would reassess and evaluate the work and re-examine possibly if you're doing any kind of framework dimensions. And then you would also talk about transferring and termination. Now, you don't have to have all these variables, so don't feel overwhelmed as I'm talking about them and you're thinking, oh gosh, I have no idea how I'm going to be able to make all those changes. And I included that in the paper because of my certain context. Not an issue. Really what you're going to follow is this rubric. So you want to make sure you're talking about a practice situation, but don't give me enough information to where I could identify that person. But talk about the particular practice setting in terms of the dimensions of the policy, the technology, and the organization. Then talk about a description of the practice decisions that were made and how those were impacted by dimensions of the policy, technology, and the organization. And then talk about proposed changes that will help you more ethically and culturally treat or serve those clients. And then you would talk about it on the practice level and how this might change goals and objectives, the outcome measurements, the use of contract, strategies, interventions, and all of those types of things. So I'll give you an example that I think could be used in this paper. So if I'm talking about a specific practice situation, I saw a client once whose mother brought her in, and she was in her mid-teens, and the client identified as a lesbian. And the mother brought her in to me, hoping that I would perform conversion therapy. And conversion therapy is a type of therapy where basically you, as a therapist, you take all measures possible to try and make that client straight. So the policy at my organization that I was at the time was to not really try and have conversations about this, not try to approach the parent in a controversial way or to call attention to the dangers of conversion therapy, but really just to refer out if that's what the parent wanted to do. Some really big red flags there. And so that would be what I would describe in this first section, how the policy at the organization needed to be changed or was ineffective for adequately treating this client appropriately. So I would then follow it up a little bit with the description of the practice decisions, how they were made, that my supervisor was the one who said that I had to refer the client based upon the mother's desires because of consent to a place that had conversion therapy, and that if I ethically was against this, that I did not need to provide a referral, but I could just say that I was unwilling to treat. So in this situation, I would then talk about the changes to the policy. And this might mean having upfront clear policies about the type of organization that they are and their viewpoint on such topics as conversion therapy, and the steps that a person might take in order to prevent a child going to conversion therapy. There's some controversy at the state level that potentially a parent sending their child to conversion therapy could be considered child abuse. So I would want to include that in this discussion. And then I would talk about the different goals and objectives and interventions that I might change in order to help that client system. So perhaps I would change my goals and interventions to be inclusive of family sessions and one-on-one parent sessions to talk about what it means to have a lesbian child. Perhaps I would link that person to outside resources that were more helpful, like the LGBT Center. So maybe that there's another place where the client could get better treatment. If the parent was incredibly dissatisfied with the treatment, refused to come see me, that maybe I could transfer them to somebody else who is more of a middle ground perspective on it, and would feel more comfortable treating a situation that is more controversial. So I would maybe want to talk about certain transfer policies there. And so I would spend probably about 2 pages on each one of these 4 sections, and then leave about 2 pages for your references. Now, there's not a set amount of citations that you have to have. So you can have 5, you can have 10, but whatever you think is going to be helpful for presenting this argument about this institutional or organizational or policy change. If you have other questions about it, please feel free to let me know. I would be happy to respond in email or set up a time with you to be able to sit down or talk on the phone so that I can elaborate a little bit more. If you want feedback on it, please make sure you give me a call or email me a week before, and I can absolutely give you feedback. If you email me 2 days before, I can't be guaranteed that I'm going to be able to give you any feedback on the status of your paper. But if you do it a week before, I usually can get it back to you within 24 or 48 hours. I hope everybody's enjoying this semester so far and you're more than halfway done. And I'm excited to read these final papers.